Hello, good afternoon. It is 1:15 on Sunday afternoon, and I'm just doing a quick post. And straight away, if you were to view my post from yesterday, I'm sorry, I'm never any good at using my phone to film myself. I never know where to look. You'll see that already there's a big difference in me, in the way that I am talking, in the way that I'm feeling within myself as an individual. Now, yesterday's post for me was quite hard to do, and I would say even today is quite a challenge. Because one of the things that I did yesterday, and also I believe it was the day before, was that I posted on social media for help, for support. And it is very, very hard for people to admit when they need help and to ask for help. And if anything, what my post showed over the last sort of 24 to 72 hours is who my friends really are. I'm not judging anybody, I don't want to point fingers, but out of posting that information online, only one person contacted me. Only one person was there for me. And sometimes that's all you need. You don't need a million people texting you saying, how are you? Are you okay? Or I'm sorry to hear you're having a bad day, blah, blah, blah. I had one person help me. One person who picked up that phone, who knocked at my door, who drove me from the hospital to get a refill of my medication that I hadn't had for an entire week. And that one person that helped me was my ex-partner, who's the father of my children. And the way he always puts it is that he's not helping me to help me, he's helping me to help them, because that's his job. His job is to take care of his kids. So I am sick to death of people criticising men and saying, oh, all men are scum, all they do is walk away, they have kids and forget about them. You know, at the end of the day, what makes a father to me isn't somebody who you may be married to or spend the rest of your life with. It is that person that genuinely, when his children need to come first, they come first. And he knew how sick I was. He knew I was struggling. And he just picked up that phone and he just said, right, I'm having the children. You get better, you get well. If you need me, phone me. But I don't want people to keep thinking that I am controlling you, that I am trying to brainwash you, that I am trying to tell you what to do with your life. You need to get well. If you're not well, how can you take care of our children? So over the last sort of 24 hours, I have managed to get my medication again. One of the things I always promised myself was I would never get addicted to antidepressants. I did not want to be one of those people that was a statistic who all the job centre do, or all the Department of Work and Pensions do, or your doctor's surgery does, is just pump you full of drugs just so you can function on a daily basis. I didn't want to be that person. I did not want to be that individual. But unfortunately, what the last sort of week has shown me is that due to the lack of support, due to the lack of care and due diligence that is out there, not just from my friends or my family or my loved ones, but also from the NHS and from my GP and the government, people with mental health issues are not taken seriously. I was literally spiralling out of control because I could not get my medication. I phoned up the pod, I phoned up my doctors. I even spent 4 hours in hospital in A&E trying to convince them that I needed this medication and that they needed to give it to me. And finally, after seeing someone from the mental health team, I got my prescription refilled. But the amount of waiting around, the wasting of my time, of their time, when all they had to do was look on my medical file and say, right, yes, you need this medication, yes, you need to speak to your GP, but we understand you can't get in to see them at this moment, here are your meds. But instead, nothing happened. It took me 4.5 hours almost. I Went to the doctors at 9 o'clock in the morning. It wasn't even my GP surgery. They were very concerned about my welfare. They did not want to just let me leave with a prescription. They believed I needed to go and see a psychiatrist before being given those drugs, which is great. It's fantastic. Why would you, if I am not your patient, just say, here you go, here is some medication for you, when you have somebody coming to a surgery that you've never met? You wouldn't do that. That would just be negligence. What also frustrated me was the fact that I openly admitted that I had overdosed on amitriptyline because of the pain that I am constantly in throughout the day. I have never done that before with amitriptyline. Paracetamol, yes. But every time I've gone in and I've been honest and I've been open and I have said, I think I've over-medicated, they have still let me walk out of that hospital. They have still let me walk out of that surgery. And not once have they said, hang on, wait a minute, stop. You know, this person needs help. And I have never deliberately taken medication that hasn't been prescribed to me to get attention or to try and commit suicide or to put my life or my kids' lives at danger. It's basically because I have dyslexia. And at times, I misread my medication. And then I think to myself, hang on a minute, why do I feel drunk? Why do I feel so tired? Why do I feel so disorientated? What have I done that could have potentially have made me feel this way? Have I not took my medication or have I took too much? And it's, even though I have gone and sought medical help, they were still more than happy to just discharge me. And this is what frustrates me, because mental health is not taken seriously. I am not this crazy, insane, psychotic person who is going to put my life and other people's lives in danger. But mental health is what I suffer from. And yet, I walked out of that hospital at about 2:30 in the afternoon with a prescription for fluoxetine. And the prescription they gave me wasn't even the prescription that I have been given in the past. I managed to find an old pill packet in my rubbish bin, and I was on 20 milligrams of fluoxetine. They have given me a prescription for twice that. So some stranger who doesn't even know me, who met me for probably like 2 minutes, decided that I was not a flight risk, that I was not a danger to myself, I was not a danger to anyone in society, and I could just walk out with a prescription for medication that was twice the amount that I should legally be on, based on my medical history. And nobody batted an eyelid. Anyone in their right mind, if they had seen the way I was yesterday, if they had seen the way I've been over the last several days, because I couldn't get my medication, because I was in withdrawal, because I was spiraling out of control, would never have left me unsupervised or allowed me to walk out of hospital, in my opinion. But they did. And today I'm fine, I'm lucid, I'm happy, I'm organising my house, I'm back on track. But yesterday, this was not who I was. Compare the video to how I was yesterday. And the only thing that I was concerned about, and that obviously my ex was concerned about, was the welfare of my children. All he can say to me is, they're safe, they're well, they're happy, they're fed, they're clothed, they're watered, they're going to the park, they're having a day out with daddy. Do my children know I'm ill? Of course they know I'm ill. I would never lie to them about me being ill. My oldest is 9. He knows when mummy is having a crazy day. And he'll be the one that if I don't phone their dad, he'll phone them. He'll be the one that if he thinks that I shouldn't be on my own with him or my brothers, or his brothers, sorry, he'll be the one saying, phone daddy now, mummy, otherwise I'm going to phone 999 and get them to take you away. And I don't think mental health should be hidden. from people within your family and your loved ones. But it just amazed me how I put a post on social media, on Facebook, and out of everybody, the only person who came to my aid was my ex-partner. And one of the reasons we're not together is because of my mental health. It wasn't fair for me to put him in a situation where he felt like he was my enabler, where he felt like he had to take care of me all the time because I was sick. And the amount of criticism, the amount of verbal abuse he has endured because of this from my friends, from my family, saying how, oh, if he really cared about you, he'd still be in your life. He does care. He cares about his children. That's his job. His job is not to babysit me. I need help. I need support. I need guidance. That's what mental health team's supposed to be about. That's what the government are supposed to be doing. They are constantly saying how we have got young minds. We've got funding to support mental health and well-being. Where is that funding? Where is that support? Because I'm telling you now, where I live, in Nuneaton, in Warwickshire, there isn't any. It took me 20 years to be diagnosed with PTSD. 20 years. No one should have had to have waited that long. And the only attitude that I am faced with is, oh, that happened to you 10 years ago, that happened to you a few years back. We don't care if this happened to you yesterday, today, or 10 years ago. Get over it. Get on with your life. The amount of times I've had people say that to me. Oh, that's in the past. Get over it. Get on with your life. Okay, yeah, okay, I'll try and get over it. Get on with my life. But the moment I get pulled into a job interview, okay, what have you done for the past 2 years? I've looked after my son who's disabled. I'm unemployable. Where was the last job you worked at? Well, the last job I worked at, I had to take my employer to court for unfair dismissal. The job I worked at prior to that, again, I was unfairly dismissed. Nobody wants to know the truth. Nobody wants to hear that how my employers have locked me in cupboards and forced me to sign paperwork. Nobody wants to hear that I was sexually assaulted by three employers that I worked for. And sometimes it is really hard to just get over something like that. It doesn't matter whether somebody has suffered some trauma, whether it was this morning, yesterday, or 20 years ago. That trauma is still there. It doesn't ever go away. The only thing you can do is try and live every day you possibly can. And hopefully not have to endure flashbacks, not have to walk into a room and get triggered by a smell or a sound or a taste or a word. And that comes with time, and that comes with support. And the one thing I've had is time, but sadly, the one thing I have lacked and had support with is support. I have recently gone back to counselling, and I will admit the counsellor I have at the moment, she's amazing, but it's been really hard for me. I've had to constantly relive very painful experiences. And does my medication help with that? Yeah, it does. Do I want to be taking it? No. And at the same time, if I don't take it, I will have a day like I had yesterday, or the day before, or the week that I've just had. So I'm posting this today to make people aware that they are not alone. And please do ask for help, but bear in mind, you may only ever get that one person who helps you. And that's all you need, is that one person who reassures you to tell you you are not alone.